Hello and welcome to a new episode of Carger People and Science Live, streaming across LinkedIn, X, and YouTube. I'm Francesca Brazzarotto, your host, and today we're diving into a topic that's both fascinating and transformative: the powerful connection between what we eat and how we feel. We often think of food as the fuel for the body, but what if it's also fuel for the mind? What if the meals we choose every day could help us build mental resilience, balance our mood, and even support recovery from depression or anxiety? This emerging field, known as nutritional psychiatry, is changing how we think about mental health. And our guest today is one of its leading voices. Dr. Ali Jaffe is an NHS doctor specializing in psychiatry, an award winning mental health advocate, and the co founder of NutriTank, a pioneering platform focused on nutrition and lifestyle medicine in clinical care. She's been recognized with honors including the BBC Food and Farming Award, the Diana Award, and a Prime Minister's Point of Light Award for her work reshaping how healthcare professionals are trained to think about food and mental health. Dr. Jeffy speaks internationally on nutritional psychiatry, youth mental health, and her own experiences, blending science, clinical insight, and humanity into everything she does. In our conversation today, we'll explore questions like how does food influence mood, anxiety, and depression? What small realistic changes can people make to support their mental well-being today? And importantly, how can healthcare professionals start meaningful conversation about nutrition with their patients? So let's dive in, and thank you for being with us today, Dr. Ali.
Thank you so much for having me. I'm so delighted to be able to talk about one of the subjects that I'm deeply passionate about. And I know being an Italian, food is very important to you. So excited to dive in.
Absolutely, absolutely. So it's great to have you here. So let's start by setting the scene. So nutrition and psychiatry, as I mentioned, is still a relatively new and fast-growing field. And through your work as a co-founder on NutriTank, you've also been at the forefront of this kind of conversation in the UK, bringing food and mental health into the same spotlight. For those who might not be familiar with the terms we are using, what exactly is nutritional psychiatry, and how does it differ from traditional psychiatry?
Absolutely. So I'd say nutritional psychiatry is a subspecialty of psychiatry in the same way that we have forensic psychiatry, liaison psychiatry, etc. And it's a really nascent field. So there was a pivotal paper by Professor Jerome Saris in 2015 that put nutritional psychiatry on the map, discussing about how nutrition should really be mainstream when it comes to treatment of mental health conditions within psychiatry, in the same way it's viewed as important in cardiology and other specialties. And then when we'll go on to talk about it in more detail, there was its pivotal first randomized control trial by Professor Felice Jacka and her Food and Mood group in Australia. And that was in 2017. So we're talking in really recent times. And what the field seeks to do is highlight that nutritional interventions can be beneficial for not only recovery when it comes to mental health conditions, but actually, in certain cases, it can put mental health conditions that are common, like depression and anxiety, into remission. And that's what was proven by this SMILES randomized control trial, where 32% of the participants were able to get their depression into remission compared to the control group. So it's a really exciting field. And I think it goes to show that we aren't always able to pull upon other intersections. We think of medicine as medication, surgery, and we need to actually think about other intersecting things in society like food, movement, social connection, and pull those in to actually talk about what's important to that human and how they can actually make a much better recovery and improve their quality of life.
Yeah, absolutely, absolutely. Bit more of a holistic view of everything rather than specialized medicine, and then without connections between the various fields. Absolutely. So thank you so much for making the distinction for clear for me and the audience. Now, your passion for this topic is not just professional; it's also personal. So I have two questions, and the first one would be: what first sparked your interest in the connection between nutrition and mental health? And also, you've been quite open about your own lived experience with depression. So how has that shaped the work that you do in psychiatry and as an advocate today?
Absolutely. So I refer to myself as a doctor as well as a patient. And I think it's so important to lead with vulnerability because so many people in society who have high powered jobs or are in caring positions have their own lived experience, but sometimes they're not able to share that. And then as a young person going into the field or wanting to be inspired, you can't be what you can't see. So I do try and use my story around my mental health challenges to inspire others that you can go from struggle to strength. So for me, halfway through medical school, I fell into quite a deep and severe clinical depression. I nearly didn't make it back to medical school. And in that time, I was already really interested in nutrition, but I had previously been using food more as an emotional crutch. And during that time, I lost my appetite, which is one of the symptoms of depression. You can go either way. Appetite can either increase or really drastically decrease.
Mm.
And I want to really get across the point that when we talk about things like nutrition and lifestyle psychiatry, they are by no means in opposition to traditional psychiatry and psychopharmacology. So, by that, I mean the medications we use in psychiatry. And for me to actually get out of the depths of the darkness and be able to even just wash my hair, take a shower, have a night that wasn't filled with insomnia, I did need to go on an SSRI, a selective serotonin reuptake inhibitor, so a common antidepressant.
Mhm.
This is where I talk about treatment very holistically, and I use the metaphor of imagining that you're drowning out at sea. And this is, what worked for me and how I like to visualize it. So hopefully it's useful for others. But when I was very depressed, I felt like I was drowning out at sea. My arms were flailing in the air, and my head was just bopping above the water. And at any moment, I could just completely sink down and never look back. And I couldn't even visualize the shore. So, what did recovery look like? Where was the dry land? And when I finally plucked up the courage and got rid of that self internalized stigma as wanting to be a doctor that looked after other people's minds and being embarrassed that I couldn't look after my own, when I finally saw my primary care doctor, my GP, and I went on an antidepressant, within 3 weeks, I was able to reduce the brain fog, sleep a little bit better, eat a little bit more to actually have full coherent thoughts about what my next steps were with recovery. And that for me is a symbol of the life jacket being thrown out at me at sea. And then
Yeah.
to actually swim back to shore once I was able to visualize the dry land was where I implemented nutrition, talking therapy, restored my social connections that I had withdrawn from, went back to creative outlets like the arts, which are so nourishing for my own mental health,
Mhm.
and went back to movement and ensuring I had good sleep hygiene practices. And so
Mhm.
that for me is holistic psychiatry. And I think nutrition can be complementary to one's recovery with mental health. Alongside traditional medications, talking therapies, etc., or for less severe cases, it can be the only treatment. But I think it's really important, and this is what's so important to evaluate as a clinician, is you have to meet people where they're at and never judge what intervention works best for them, because everyone is an individual and there's no one size that fits all. So nutrition became a very powerful intervention for me, but it was alongside psychopharmacology. And as I've got stronger over the years in terms of my mental health, I've managed to reduce my medication, and in some cases, people get deprescribed off their psychiatric medication if it's appropriate. And then things like diet and lifestyle interventions can be used alone. But like I said, everyone will be different, and it's all along a spectrum, and psychiatric medication can be absolutely life saving.
Now that's great to hear that because I'm gonna bring some pop culture into the mix here. We're gonna talk about that later, but sometimes you do see examples online, and I'm talking about. I don't know if anybody's seen Netflix or a streaming platform with apple cider vinegar
Oh,
series where they were just saying you
horror
just need to eat in a certain way in order to fight cancer or this or that, and then people read these things online and follow this without following proper medicine and then taking care of themselves from a medical point of view. So I'm really glad that you also underline this point, that it's not something in contrast, but it's in addition to what psychiatry can help you with. So
Exactly, Fran. And, I sit in the messy middle as a psychiatry doctor, and that doesn't make me necessarily very popular online because I don't go viral with clickbait, this is what you should do and what you shouldn't do content.
mm,
I think it's so important that when we give patients information, we give everything to them and then they can make their own informed decision, weighing up the pros and the cons.
mm,
And for, taking the example of apple cider vinegar, to completely disconnect from mainstream traditional treatment, especially when it comes to something like cancer, is
mm,
incredibly problematic, especially
yes.
when you take advice from an influencer who has no qualifications and says, well, this is what worked for me,
Mm,
it will work for you. And we know in the case of Belle Gibson and apple cider vinegar, it was all a lie anyway. She never had cancer to begin with. So
yeah.
it's so important that we have credible, evidence-based voices online, and we teach the public how to critically think about the information that they flick through every day.
Absolutely. And I think we should go back to that as well a little bit later. I just want to go back to the lifestyle kind of and tips that you can also give to people listening. So before we dive into that, let's just clear some confusion. There are a lot of noise, especially online, around food and mental health, and not all of it is accurate. So what are some of the most misconception or myths about the link between what we eat and how we feel, because we hear about, miracle superfoods or miracle restrictive diets and things like that. So it's all about the lifestyle, not just, what we eat, but what did you see online or around in books that people should be aware of?
I think people get really excited when they realize that the gut is actually our second brain. And why it's been termed that is because it's got such a high number of serotonin receptors. And that's why it's termed this second brain. So people assume that your gut's serotonin can actually travel up through the bloodstream, cross the blood brain barrier, and then target the brain. But actually, that's false, and serotonin cannot get through the blood brain barrier. So, if you imagine it's like a jigsaw and the pieces just don't fit across. So, I think, certain marketed brain foods can trick people into thinking that what they're eating can produce happy hormones straight away that cross the blood brain barrier. And it's just not as simple as that by any stretch. We've got our wonderful gut brain axis, which is the connection between our gut and our brain. It's a bidirectional pathway where our gut impacts our brain and our brain impacts our gut, which is why people with inflammatory bowel disease have a lot of comorbid mental health conditions. And it
Mm,
works vice versa as well, that people with mental health conditions or high levels of stress can have manifestations in their gut, like irritable bowel syndrome. And we know
yeah,
that one of the common stay treatments for IBS is to manage stress and to do cognitive behavioral therapy.
yeah.
So we know that that connection exists. And again, I think that certain things in the wellness culture can kind of oversimplify that and
Mm,
say, without kind of giving any sort of nuance, that this will work for you. Your brain fog will be cleared if you take these brain health smart supplements. It will help you with your concentration. It will get rid of your bad mood. It will help you with your sleep. It's this the panacea. It's this cure all that you're promised. And I
yeah.
think that's overly simplified again. And also really draws away from a whole food approach, which is the approach that I most align with, to say, well, it's not a pill for every ill anymore. It's now a nutraceutical or a nutrition supplement for every ill. And I think that we need to be very careful about trusting the nutrition supplement industry too much. and be aware of when supplements are actually indicated. So I think that that's one of the misconceptions. And also, professionally speaking, in the clinical world, nutritional psychiatry is so new that so many of my colleagues don't actually know much about it. And when I introduce myself and I say, I'm interested in food, I'm interested in mood, I'm interested in nutrition, and I'm interested in psychiatry, people assume immediately that I'm interested in eating disorders, and that's what I want to subspecialize in. But actually, the field of nutritional psychiatry, whilst it can benefit people with eating disorders, no doubt, it actually serves to benefit people with all mental health conditions. And it's part of mainstay treatment for every mental health condition, rather than just saying that it's solely for a group of people. We have the most research for common mental health disorders such as anxiety and depression, but we have more and more research coming out around severe mental illnesses, so bipolar, schizophrenia, schizoaffective disorder, and developmental condition wild, which is ADHD, autism, and that kind of
Right.
thing. So I think it's really important to just highlight that improvements can benefit everyone, and it's not just for one set of people.
Right. And I think you were mentioning the study by Professor Felice Jacka, right?
Yeah,
You have the book.
lovely book.
So I did some background reading as well. So yeah, and I just, I'm not a nutritioner, I'm not a doctor. So reading that really kind of opened my eyes to how difficult it is to create a study that can actually show the benefit of nutrition and the impact on your mental health, because there are so many factors to keep in mind. It's not just about how why somebody eats something. Is there a cultural background? Is there lifestyle? Their how much they earn? Are they able to afford some type of food? And what kind of diet they're on? So it is really difficult to establish something that is true for everybody, right? But going beyond that, what does the current research and evidence say about these eating patterns? Like, is there a specific diet? I don't know that you mentioned Mediterranean diet earlier, that can really help us, has a good impact on our mood or our anxiety or our depression.
Absolutely. So I guess I'll just reiterate what I said at the start, that in 2017, the SMILES trial, which was Professor Felice Jacka's really pivotal first randomized controlled trial looking at nutritional psychiatry in action, um, was this huge landmark study that highlighted that when they had 67 participants, so middle-aged women with major depressive disorder, that when they sectioned them into the treatment arm and the control arm was that these women would have a befriending intervention, so it was a social intervention, and then the treatment arm was that they would be given the modified Mediterranean diet with dietary support from a dietitian. That, like I mentioned before, 32% went into remission of their depression symptoms compared to 8% in the control trial. Now, the limitations of the study was that the sample size was just quite small, 67
Yeah.
women. However, it's very difficult in psychiatry in general to do research because the participants are struggling with a condition that causes them to have low motivation. It's hard for them to look after themselves, etc. And there's not much incentive to be part of the trial. So I think it was brilliant given that. And also adding on an extra layer, nutrition studies are incredibly difficult because it's really hard to double blind someone. And what we mean by that is when we have a pharmaceutical randomized control trial, it's very easy to give someone a placebo pill that looks the exact same and then the treatment pill. But with food, you taste it, you look at it, you smell it. It's very hard to say, I'm not eating this banana right now. So it's essentially very difficult in nutrition to do really good quality research that is in keeping with our hierarchy of evidence in academia of randomized controlled trials at the top. But she did the most incredible job. And whilst there were limitations of the study, it showed, as this landmark study, that diet can be a treatment target in psychiatric disorders. Now, much more research has come out since 2017. What was exciting around the time of her first trial was actually a group doing very similar things to her food and mood group created another randomized controlled trial called the Healthy Med study that just further consolidated, yes, the Mediterranean diet can help for common mental disorders like depression. Since
Mm.
that, there's been a snowball and explosion of nutritional psychiatry research. And
Yeah.
more recently, we've actually seen that nutritional psychiatry as an intervention can be even more cost effective than talking therapy. And that was done in Australia in 2024. And that was done by Professor Adrian O'Neill. And it was landmark for that time as well, because it
Hmm.
showed that actually, if you are in charge of your hospital, or if you are in charge of the entire healthcare system, let's really put food on the map, not just as a nice to have, and not just part of hospitality when you go to hospital and in the same way your room gets cleaned, that you get served meal. Let's talk about it in that therapeutic and health economic sense, because
Mm.
we know that talking therapy, especially in the UK, has such a long waiting list
Yeah.
for people to access that sadly it is easier for doctors to prescribe a medication because the patient can access that straight away and it's a quicker fix than being on a waiting list. Talking therapy doesn't always work straight away if you don't build a therapeutic relationship with your clinician, etc., etc. Again, not all medication works on everyone first time round either. Everyone's an individual.
Absolutely.
So,
Yeah.
in terms of the research, we're really building up a basis. And Australia, the biggest shout out to them, they're way ahead of the game. They actually have diet as an intervention in their depression guidelines, in the Australasia, I should say. So, New
Mm.
Zealand, Australia psychiatric guidelines. Whereas in the UK, we don't have that. Exercise is more commonly represented over diet when it comes to talking about depression
Right.
treatments. And
Hmm.
I think it's exciting to see that severe mental illnesses are also starting to have more research into them when it comes to nutrition. There's still a long way to go before we can make conclusions about that.
Hmm.
But I think from a metabolic health perspective, I'm excited by the space where it comes to talking about improving the metabolic health of people with severe mental illness, so schizophrenia, bipolar, because we know that the second generation antipsychotics that we prescribe patients, they're very effective. However, the downside of them is that they increase the metabolic burden on that patient. So it's kind of what's the better of two evils when you're prescribing as an inpatient to someone who's very mentally unwell? Is it
Mm.
that you help their schizophrenia or that you prescribe them a medication that makes them put on 20 kilograms and tips them into pre-diabetes, high blood pressure,
Yeah.
metabolic syndrome, etc.? And what I really hope to start seeing, and I really hope guidelines can mirror this in the future, is that we are mindful when prescribing antipsychotics that yes, we do vital signs very often, so taking people's blood pressure, etc. But are we
Hmm.
giving dietary advice and making the hospital environment in which they're staying in and recovering from their mental illness, are we making that actually productive to being able to keep their metabolic health at an appropriate level? Or is it laced with ultra processed food galore? I think we know the answer to that, but that's what I'm really excited about at the moment. And I just think we need a lot more policy focus and more studies done.
Yeah, no, I made a really good point, and I think nutrition as a tool to prevent things happening would be the best course of action, right? So more education, and I know you'd be involved with that a lot, and bring it to the schools and starting with with the kids when they're young, trying to choose the right diet for them that is not all about fried and processed food, and try to avoid, because I think I read the higher cases like of depression or anxiety or mental health kind of diseases will come around puberty, right? So that would be a place to start more education in that sense.
I think we have to target adolescents, and it's just absolutely paramount that we get in there from an early intervention perspective, because actually it was in the headlines probably a month or two ago in the UK that
Mhm.
um, mental health issues and obesity are now the top two issues that adolescents are dealing with. And I find that really fascinating that those two are coming up at the same time. And I'm not going to, overplay the two parameters, but we know, according to Felice Stracker's work again, that actually ultra processed food and Western dietary patterns, so dietary patterns that are rich in whole foods and Mediterranean dietary principles and rely a lot on ultra processed foods, that they actually shrink an area in our brain called the hippocampus, which is a really cute seahorse shaped region of the brain that's responsible for memory and really
Mhm.
cognition. So if we are not supplying our young people with brain healthy meals, and they are skipping breakfast, and they are not entitled to free school meals that are nutritious, and they're either fasting all day or relying on cheap ultra processed food and energy
Mhm.
drinks with high levels of caffeine, not appropriate for their age range, that could stunt their growth, then what are we doing for our future workforce's memory and cognition if we're not supporting their brain health as they're growing through adolescence? So I'm so glad you bring up adolescents, because they're my favorite group of people. Big up the Gen Z population. I think they get a very hard time, but they're the demographic that I hope to really make an impact on. And we're seeing youth mental health rise, we're seeing childhood obesity rise, and we're just seeing our
Yeah.
workforce also dwindle. So what are we doing? We need a society-wide food strategy that addresses workplaces. If young people are leaving school at 16 and going into the workforce, school food approach, and really good advice when they go to their clinicians as well.
That was going to be my next question, like going to the practical side of things. And I know
Yeah.
we have quite a few people listening today, or that registered to see the recording, that are in clinicians or in the nutrition field. And so, how do you see healthcare professional apply these insights in their day-to-day work? Like, how can
Yeah.
clinician and mental health professionals start meaningful conversation about nutrition with the patients, young or old, or any kind of patient, really?
Absolutely. So I'll start from the beginning with a story about how I became passionate about nutrition in healthcare and my work with NutriTag. So I've been qualified as a medical doctor now for 4.5 years. And when I started medical school, I was really shocked. I was already interested in nutrition, and I had grown up very luckily with a lot of whole food around and some really strong lifestyle principles from my wonderful mother, who has been a Pilates teacher since I was 4 years old. So she was always kind of a really positive lifestyle influence on me. And I got to medical school absolutely enthused to start learning about human disease and prevention and all of that. And I thought I'd be learning about nutrition as a mainstay treatment, because I'd read so much research about this.
Hmm.
And instead, I learned about the physiology, the anatomy, and the biochemistry of the digestive system, but not anything about nutrition coaching and nutrition education to actually help that individual sat across from you live a better life. And I was really surprised, because this disconnect just seemed quite unfounded, considering that our treatment guidelines, the National Institute for Care and Excellence, NICE, the guidelines for every chronic condition, the first line management from polycystic ovarian syndrome to diabetes to cardiovascular disease is offer patients diet and lifestyle advice in the treatment algorithm. And then it
Hmm.
goes to first line medication, and in some cases surgery and beyond. And I thought, well, it's in the guidelines, lip service is being paid. Why am I not seeing my senior clinicians on my hospital placements have these conversations with their
Yeah.
patients? Why am I not seeing it in my GP placements? And why are we not learning about it, especially when we do clinical consultation skills? We
Mm.
learn motivational interviewing in medical school. So that's when I made a nutrition in medicine society group. I met my co-founder, Dr. Ian Broadley there. He was a grad medical student at the time. And we just had a meeting, and we're both completely on the same page and said, let's do something big with this. This is clearly an area that needs a lot of attention. We need a systems approach. It's not just our medical school, it's every medical school in the country. It's actually every medical school in Western society. They do not prioritize a proactive approach, they prioritize a reactive approach. And that is
Yeah.
symbolic of our society and modernization, industrialization, etc. And so we said, let's do something about this, be disruptive millennials. So we created NutriTank. We're now an award-winning nutrition in medicine education organization. We run weekly CPD webinars. We've got courses. We've won lots of awards. We've contributed to the NHS long-term plan. We've worked with Jamie Oliver on policy and with the Department of Health. We've worked with NHS England on hospital food strategy. And what we're really focusing on now is actually how can we bring this to psychiatry care? And in
Mhm.
October 2024, we had our first contract that was approved by NHS Cornwall Mental Health Trust to actually educate 500 members of their mental health staff in nutrition and lifestyle psychiatry and arm them with these skills to help their patients. And that was a huge first for us. And it goes to show that people are interested in this. They need the money, obviously, to fund it because a team of experts, we're not doing it for free. But more
Mhm.
so, we need to actually show that it's a priority and that it works. So it's so important that clinicians are taught this in medical school. But if you miss that window, I think the postgraduate education is so important. And for all the exams that we take when you're becoming a specialist, it needs to be integrated into there, have appropriate case studies, clinical discussions about nutrition and lifestyle interventions, no matter what specialty you're in, and also learn with patient actors how to discuss the issue sensitively, especially when it comes to weight loss. How do you approach these situations sensitively, but also how can you talk about nutrition to someone living on the breadline, on benefits,
Yeah.
and that's why you need to have the education about the social determinants of health and really understand how you can impart to your patient how to eat well on a budget and dispel the myth that it's always more expensive because
Yeah.
beans and tin are, cheap as chips. So I think how can clinicians be armed? They need to treat the person as a whole. They need to see where the person is coming from their socioeconomic background. But they also really need to pay attention to their cultural background. We've
Yeah.
spoken a lot about the benefits of the Mediterranean diet, and I do harp on about it because I love the Mediterranean diet, but also it's the largest evidence basis we have in terms of diet and health in general, whether that's longevity, cardiometabolic disease, women's health, or psychiatry. But actually, in nutritional psychiatry research now, we've got studies showing that the Norwegian dietary pattern and the Japanese dietary pattern are just as beneficial for mental health. So what that tells us is there are nutritional psychiatry principles, and you don't need to be too prescriptive because I'm not going to tell my patient from a global majority to go on a Mediterranean diet when it means nothing to them and they've never cooked with olive oil or eaten, certain fish that I'm talking about before in their
Mhm.
lives. You have to make it meaningful to them,
Right.
and that's the way you can enact behavioural change sustainably. A very long answer, but I think
No,
that's the
that's
element.
great. Thank you so much. I think that's really interesting. I think it's very important, and I think the listener will appreciate. There was actually a question from um, one of the listener. She's getting to the nutritional coaching field. Is there a certification that can give me the tools to help people with this nutritional focus on food and mood, with the intent of working with a nutritional psychologist who would do the actual diagnosis and protocol? So I think that's an interesting question. I don't know if it's something you can answer right now, but we can also, gather some more answers from Dr. Ali and send out to everybody that registered to the event some answers afterwards. If we can't answer now, I don't know if you want to
Yeah, I
add
mean,
something.
I'll say I don't know obviously what region of the world you're coming from because nutritional coaching can mean anything. And obviously I can only talk for the UK, and in the UK we have health coaching, being a nutritionist, being a dietitian, being a doctor, etc. So
Mm,
I don't really know what I wouldn't ever say I know much about the nutritional coaching field, if that can be elaborated on. But in terms of how can you implement food and mood with your clients, there's brilliant resources on our website, www.nutritank.com. We've got CPD, food and mood webinars, as well as courses, and also the Food and Mood Centre in Australia, Professor Felice Jacka's group, have great handouts, infographics, and again, courses and webinars that can really help get to grips with the right principles to impart on your patients. But I wouldn't be able to say I know much more about nutritional coaching. That's not a phrase we use here much.
Okay, I can see she's from the US, by the way.
Okay.
She just commented. But thank you for your answer. And we had a few comments about somebody who's a parent of a teen and said that the food choices are woeful, and coupled with disorder eating on the rise, it's really tough for teens to create healthy habits whilst at school. So that is very true. And that's something that, policies would have to help with.
Absolutely. I think what's so important for young people is to actually learn that their self-worth, it doesn't need to be attached to what they look like on the outside. And that's so simplistic. And I was the exact same as a young person. So I'm not in any high horse, but I do think that we need to teach self-compassion at a really young age, and also teach young people that they have talents that go beyond the general curriculum school, being good at maths, being good at music, arts, etc. That actually there are all these soft skills that you realize when you get into workplaces, like being a good connector, being a good networker, being a good listener, that I think young people need to be empowered and validated, and that will really help kind of offset their kind of drive to be more image focused. And obviously comparison is the thief of joy, and it's so hard in schools when you're around your peers all the time not to compare, and people hit puberty at different rates and will have different genetic body types. But I think if in schools they could really address a lot of the what we call soft skills, which should never be really termed soft skills, around building resilience, building self-worth that isn't attached to things from the outside, then I do think it will have a knock-on effect to how you kind of develop these maladaptive coping mechanisms to make yourself feel worthy in a way.
Yeah, absolutely. Thank you. And I think that, education about nutrition should be mandatory everywhere since the beginning in school, just because it's something you do every day.
I think it has to be nutrition coupled with psychology, because nutrition just on its own, you'll never be able to convince someone to make that behavioral change unless it's meaningful to them. So that's why dietitians are so skilled with motivational interviewing. If you understand what someone's budgets is, what someone's culture is, how many mouths they're feeding, how much time they have, and what's meaningful to them. So not just making it all about the weight on the scales, but if a middle-aged man can no longer lift his toddler over his head because he's put on weight and his metabolic health is poor and he's panting when he's running around with his toddler, then you hook into that and say, well, what if we can make changes so that you can lift your little boy, and rather than making it, so if you make it story based and really about that shared humanity that you have with that client, rather than judging them and saying you need to change this because you look a certain way. So I think the psychology is absolutely paramount. Yeah,
no, absolutely. And so I'm conscious of time because honestly I could ask you so many questions, and there's so many coming in the chat, so many. But just to kind of, I think, summarize some of the comments here or questions. We were talking about kind of people being bombarded by information, social media, TikTok, all kind of things, even books. Sometimes they are not based on good research sometimes. What is a practical tip that you can give out to our audience to kind of make sense of what's going on, how they can take care of their nutrition and their mental health without being, pulled in every direction by people that say they know what they know what they're talking about? What would be your main tip?
So I'm going to start off by saying that I think it's really important healthcare professionals' voices are at the forefront of delivering nutrition education, but with a caveat that healthcare professionals can be part of the problem as well. So I think the main thing is critical thinking. And what I mean by that is healthcare professionals can fool the public with authority bias from their titles and the letters after their name, but they could be unethical and have their own agenda and say, I'm just going to go pro carnivore on you, or I'm just going to go totally vegan on you and not see any messy middle, which is where I sit. I'm diet agnostic. I say to the individuals that I see, I'm going to give you the information, the evidence, but you must make your own mind up with with weighing it up and create your own informed decision.
Mm,
So I think that whilst healthcare professionals can be part of the problem, there are some really good experts by experience that are ethical and won't just say this worked for me, therefore it will work for you, but will say this worked for me, but it may not work for you, and I don't want you to do anything until you consult your healthcare professional, your dietitian, your registered nutritionist, your GP, whatever. And I think
mm,
that's very sensible. So I would say, in terms of top tips of how to look out for red flags online, is see if there are sensible signposting once someone makes a statement. So blah 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 blah, but go on to this website that has evidence-based nutrition resources to kind of make the right choice for yourself, or consult with your GP practitioner, whatever. That's very sensible. The things that are less sensible is when there are influencers who are standing in um, their kitchen or their gym with their top off, and they're making it all about what they look like, and they're subliminally trying to get into your consciousness and say, if you want to look like this, and I'm showing you what healthy looks like, then do this. And
mm,
I don't, each their own. I don't think that's exactly how we can communicate health information accurately, but it seems to work for a lot of the masses, because again, it goes down to this body image thing. As people see a certain person looking a certain way, say, I want to look like that, I'm going to follow what they're doing. So to be aware that people who are showcasing themselves, they could have a hidden agenda, not always, but to just have that kind of critical thinking.
mm,
Likewise, if they are being incredibly condescending about the traditional system and how bad it is that mainstream doctors don't do this, that, and the other. Whilst we can do a lot better in terms of mainstream care, and we need more nutrition in the conversations, if they completely rebut traditional medicine and say, just go the naturopathic way, just eat like how our ancestors eat, and eat raw this, and don't touch medication, and blah 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 blah, go for this
mm,
clean eating lifestyle, then you know that there's extremism there. So that would
yeah.
be my other points, is look for extremist language. If they are literally dismissing everything in modern healthcare, then there is something worrying there, and there's an agenda. And always see, are they trying to sell you something? Are they trying to sell you a detox program? Are they trying to sell you one of their products, like a green powder, which not good evidence base behind that, or some sort of slimming tea? What is their agenda? Because
Yeah.
these people are very clever with marketing and clickbait titles. So if
Mm,
there's nuance missing, I would always question it, because as we've discussed, everyone's an individual, no one size fits all. And if something sounds too good to be true, this supplement, this multi-nutrient supplement will cure your brain fog, your ADHD, your this, your this, your this, yes, your menopause, your this. There is no such thing as a magic pill. So be really skeptical, a healthy
mm,
amount, around what people's claims are, and be aware that healthcare professionals are not allowed to make health claims about certain products. We're not regulated to do that, but sadly, influencers can. So they do have a loophole, and that's why they can get away with a lot more, which is really sad. And
mm,
it's just having that healthy level of skepticism, and also seeing how much are people using their qualifications to also bamboozle you, because like I said, healthcare professionals can be part of the problem as well. So it's critical thinking that really needs to be taught. And in terms of dispelling misinformation, I think there are some brilliant initiatives that are being done by some of the tech giants. Yes, there's a lot more work to be done, and I will be the first person to say that. But I will say that TikTok have created in the UK a clinician council, which I'm part of. So everyone follow me on TikTok. And it's all about getting together healthcare influencers to try and guide credible campaigns that can then be promoted. So we're actually doing one with Department of Health in the UK this week on health tourism. And then we are credible voices that are being promoted and showcased, and it will hopefully drown out some of the less credible misinformation, but it will only scratch the surface. And likewise, YouTube have got YouTube Health, where if you use their search engine and you say, how do I eat well for polycystic ovarian syndrome or whatever it is, you will then be guided to videos in their health shelf that have been quality assured and have been created by healthcare professionals. So there are, good
That's
interventions
great.
being, but it's slowly, but yeah, surely, hopefully, will make more of a dent soon. But it's early stages, and I think
Mm.
we just have to learn these red flag skills. And when people use certain arguments and fallacies, so appealing to the nature fallacy that just because it's natural, it doesn't mean it's healthy. For instance, so we know that there are so many poisonous mushrooms, so people will really try and disrupt a lot of your thinking patterns to try and get inside your head. So it's just about getting ahead of the game with that.
Thank you for sharing. I think that the kind of this new program on social media like TikTok and YouTube, it's really important, especially for we were talking about people in their being adolescents and be the main category of people working with TikTok. So I think it's a great thing that these things are coming about, and you're part of it as well. So thanks for sharing. I wanted unfortunately we're running out of time, and I really want to finish with asking you with a one message or main takeaway from this talk that you would like to share with everybody. But I also want it to be a bit more fun because there's a lot of information. So I'm just gonna go with a light question, and then for all the other questions that we didn't manage to answer live, we'll try and get them answered somehow, maybe in a blog post or something with Dr. Ali. So if you had to pick one only food that you think is the best tasting, the best in the world, and is also the best one for your mental health. I'm gonna put you on the spot. A disclaimer,
Yeah.
like you don't have to take this advice. We're just asking for fun.
So,
What would that be?
okay, so my top tip for eating well for your brain health would be
Yeah.
the triple F threat, and that is fiber, fermented food, and fish. And obviously, not everyone eats fish, but fish
Okay.
is really high in omega 3s, as is other seafood. We actually know that by conclave, so mussels and clams are highest in omega 3. So I'd say triple F if you're wanting to eat better for your brain health, but obviously you can
Okay.
get
Very
an
good.
omega 3 supplement if you are not a fish eater and are plant based. But my top food would
Yeah.
be, if I were to have one dish, it would probably be, it's so difficult. I'd probably
The most
say,
difficult question of the whole thing. Yes.
I know, because I love so much. All right, Ali, make up your mind. So I guess I love Italy, so I'd probably go for a spaghetti vongole.
Oh yes,
I'd
that's
say
great.
that would be amazing, omega 3s. And for me, food is so much more than just its nutrients as well. And that's why, again, I do think we need to be really conscious of the supplement industry, because food is a connector. A hot bowl of food can feel like a warm hug. You can connect with people. It's a vehicle into someone else's culture. It's a way to celebrate. It's a way to grieve. And so it's a real language. So I would say that when picking this bowl of food, it might not be the most nutritious altogether, but it means something to me, and I know that food can make you happy beyond its nutrients as well. So I'm all about an 80-20 approach. So 80% of the time I try and eat really well for my brain health, but 20% of the time, of course, I'm going to have a piece of cake and enjoy some other sweet treats, because it's so important that we remember that we're talking about the overall dietary pattern. And so as long as you can eat well for the majority of the month, you don't need to be fixated and beat yourself up for having one bad day, because we know that stress and its impact on the gut microbiome in itself can actually have a negative impact. So if you're stressing about your food choices and having decision paralysis or beating yourself up, that can also be having an impact on your cortisol levels and your gut health. So just remember 80/20, and also just really remember that food is a connector at the end of the day as well,
Yeah.
and it's about enjoying it.
Oh, that's such a good answer. I really love that. And as an Italian, I know food is everything, not just
Family.
food. It's connection, it's socializing. And I think one of our listener, Gillian, mentioned the same thing. So I think we're all, yeah, we all agree with that. So thank you again so much, Dr. Ali, for sharing your knowledge, your personal journey, and your passion for transforming how we think about food and mental health. And unfortunately, that's all for today's episode of Cargo People in Science Live. Thank you again for such an inspiring insight into how food and lifestyle can shape our mental well-being. So we hope that this conversation sparks some ideas and practical lifestyle tips that can shape your future life. We hope you will follow us again and you enjoyed the session. Make sure to follow us on LinkedIn, X, and YouTube for more live conversation where science meets real life. We'll be taking a short break in August and we'll be back on the 25th of September. Thank you again for joining us, and thank you again, Dr. Ali, and see you next time.
Thank you so much, everyone, for your engagement. And Fran, you're a wonderful host. It was great.
Thank you. Thank you. Goodbye.